Good evening and welcome to our COVID-19 update, a special edition on Channels Television on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force gives update on COVID-19, says lockdown not punitive. Lagos State Commissioner for Health reels out statistics as local infection increases from 18% to 45%. And Spain's death toll for the coronavirus falls for a fourth day. Now, according to the Nigeria Center for Disease Control, NCDC, 33 patients have been treated and discharged following the coronavirus pandemic in the country. Sadly, so far, 5 people have died, bringing the total number of cases confirmed in the country to 232. A breakdown of the cases in each of the states shows that Lagos now has 120 cases, Abuja 47, Osun 20, Oyo and Edo have 9 cases each. Bauchi has 6 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State, while Ekiti and Enugu each have 2 cases, with Ondo, Rivers and Benue states recording 1 case each. Now, the federal government today made it clear that its decision to restrict movement in Lagos, Ogun and the Federal Capital Territory, FCT, is not punitive at the Presidential Task Force briefing. The Secretary to the Government of the Federation, Mr. Boss Mustafa, called for more understanding as the decision was taken to protect citizens. He also responded to fears by some Nigerians that the 18-man committee from China may not be needed at this time, saying they are offering help on advisory basis.
The support coming from China is a corporate social responsibility initiated by CCECC, a company with a total volume of infrastructural contracts in Nigeria worth over 10 billion naira. The professionals that have been invited or by CCCE through their parent company in China to come are public health specialists and medical engineers that will support Nigeria's capacity in managing the pandemic on an advisory basis when necessary. That is expressed in the content of their letter. They wrote and suggested, should in case we would need advice on how they were able to manage the pandemic in China and have flattened the curve. As a matter of fact, China is not experiencing any community transmission. As a matter of fact, most of the transmissions that are very worrisome to China now are those that are being imported into China. They said, peradventure, we will seek and will require such assistance through their mother company because of their volume of business in Nigeria and their responsibility as a corporate citizen. They will want to offer that help. Nigeria's on an advisory basis while drawing from the experiences of the Chinese. In no way shall there be case management and interface with patients. They will train our manpower, advise on procedures and methods, install and test the equipment donated before handing them over for our technicians to begin to use them.
And response.
The health minister, on his part, says the first tranche of assistance from China arrives Nigeria tomorrow. He's also asking Nigerians to cooperate with health workers to limit the spread of COVID-19.
The United Nations group has ordered $2 billion of materials, which the first batch of it is coming in tomorrow. That assures us of being able to have all the things we need for the foreseeable future. The CCECC, as we have heard just now, has also offered us more materials, so we shall be comfortable for that. And we are particularly grateful to these groups for the help they are giving to us, and the anxiety is less. But this does not mean that indigenous manufacturers should withdraw, because they need to be able to look at the future. We don't know how long this epidemic will last. We do not know the extent of the generosity of our benefactors, so we need to be ready, and the design process for production should go on. Now, the other question was about mental health. Yes, it is a component of treatment, and if you look at video clips coming out from the Yaba Treatment Center, IDH, you will see that there are programs being set up there to occupy those who are on 14 days or more of isolation. There are programs with music and conversations and dance, which are addressing the boredom that some people might suffer. I'm sure that they have employed mental health consultants who have helped them to design programs that will help to fulfill those objectives. The Chinese experts, yes, anybody at all coming to this country will have to be subject to the rules and regulations we have set down. I'm sure that anybody coming here will know that. And we know that the experts coming from abroad, with all the valuable knowledge they are bringing, the hands-on experience which we want to learn, will still be subject to the rules that we have established, which are in the interest of our people, to protect our people. And even if we assume that they have done tests in their country, we'll still have to do the confirmatory test here.
General of the Nigeria Center for Disease Control, NCDC, 3 targets have been set as guidelines for effective containment of the virus.
The efficiency of this process, we've agreed on certain targets for all the states actively involved in this. These are targets that we will now measure on a daily basis to measure the effectiveness of our work. So I'm making these targets public because we will measure our progress based on these targets. The targets might seem a bit broad at the moment, but we will tighten this every day over the next few days, because we need to show that the time given us by Mr. President has been worth the sacrifice that Nigerians are making. The 5 key targets that we're setting for teams in Abuja and Lagos are to make sure that the collection of samples from individuals, symptomatic individuals, happen within 8 hours of notification of the state team. Secondly, that the turnaround time for testing and resulting will be less than 24 hours. This is the case because sometimes samples come in late in the evening and have to be resulted the next day. The third one is we plan to test 200 samples per day in Lagos and 100 samples per day in Abuja by the end of this week. Number 4 is to isolate patients in less than 6 hours after they have received a positive result at the state level. And we plan to isolate every confirmed case. So we will measure ourselves with percentages on each of these indicators and use that to improve the effectiveness of the response. In addition to case finding, the second most important thing is contact tracing, i.e. listing all the contacts and making sure we find all of them. This involved a very strenuous effort in sometimes following tens of contacts of each individual.
Earlier today, the federal government, at a briefing of the Special Stimulus Committee on Fiscal Measures, identified several areas of fiscal palliatives to support the economy. The Minister of Finance, Mrs. Zainab Ahmed, says this has become necessary following significant risks the country faces due to the global disruption as a result of COVID-19 and the further decline in international crude oil prices. Mrs. Ahmed lists some of the fiscal palliatives to support the economy to include 500 billion naira investment intervention Fund, already approved by the President, which the National Assembly is expected to pass a bill on. The fund is also to be used for the upgrade of healthcare facilities across a state, also financing federal government's intervention for states, and also to finance public works program, among others.
The President has approved the establishment of a 500 billion naira COVID-19 crisis intervention fund. The establishment of this fund will evolve and provide the much needed cash resources from various special accounts already existing in the Federation, and this is a process that we will be doing together with the National Assembly. We've already consulted with them, but there will be a need for them to pass a bill that allows us to take funds from some of the existing special accounts. This 500 billion naira is proposed to be utilized for upgrading of healthcare facilities, as earlier identified by the Presidential Task Force on COVID-19 and already approved by Mr. President. 2, it will also include financing the federal government's interventions to support states in improving their healthcare facilities. 3, it will include the financing and the creation of special public works programs. And 4, it will include funding any other additional interventions that may arise.
Right now, the country officer, World Health Organization, Fiona Brackett, joins us on the program from Abuja studios. Thank you for joining us at this time. I must ask what you think the long-term effect of COVID-19 is. The Minister of Health there saying that we do not know how long this will last. Should we be worried by comments coming up like that? And also, the last time we spoke, you mentioned the risks to countries like Nigeria based on our existing healthcare.
Indeed, we do not know how long this pandemic will last. We are learning every day more about this virus, and we are seeing the devastating effect that it can have on health systems and on economies. We've seen that health systems do get overstretched based on the experiences in the early affected countries, and it does create a strain on the health system. So as much as possible, all efforts need to be in place to have the long-term view on how we can help the system bounce back once the pandemic is over. So the investments into the sector, investments into the protection of personnel, the investments into the economy to make sure that the vulnerable populations do not suffer, and that indeed the system can bounce back are all critical at this stage.
All right, now talking about this, we've heard the government say that it's going to expand its intervention fund, 500 billion naira, and we have several other information out there. Are you happy with what is coming from government, its efforts at cushioning the effects of COVID-19 and other information and guidelines of COVID-19 in the country?
The guidance we provide to countries is that this response needs to be a whole of government, whole of society, comprehensive and blended approach to control the epidemic. We are pleased that in the case of Nigeria, that a presidential task force is in place that cuts across several sectors, 9 sectors or so, that is looking at the different elements of this response. So this is in alignment with our recommendations to countries. And we're also seeing the effort to identify the vulnerable groups those that could be hardest hit by the challenges of the epidemic. We have the elderly, we have the malnourished, we have IDPs, those that have underlying conditions, really trying to identify those vulnerable groups and trying to take action on them. So these are all welcome interventions that the government of Nigeria is putting in place to try and cushion the effects of the epidemic on the population, with a special emphasis on the vulnerable groups.
Come back to talking about this issue, dissecting the pandemic in Nigeria across the world. We crave your patience. Still to come, we have several updates coming in from across the world. There's still the update of COVID-19 here on Channels Television. Stay home, stay safe, save lives. Welcome back. We've been talking with the country officer, World Health Organization, Madam Fiona Braka, who's in Abuja studios. Just before we let you go, what is the World Health Organization's policy on mask wearing? Now, the NCDC says it remains a priority for healthcare workers in Nigeria, but we find that some countries saying wearing of masks by all has helped curb the spread of the virus.
So WHO is currently working with experts globally to pool the information from different countries to identify the impact of mass use of masks. So this is a work in progress as we speak now. And we also recognize that there are some segments of society that are more at risk than others. So those that directly care for patients with COVID, either in a home setting or in a hospital setting, health workers in facilities are really at the greatest risk. The other group is the patients themselves who have COVID. In terms of protecting others, they need to have masks. So we currently are advising that at the most, the high priority should be given to these risk groups, the cases themselves, those taking care of the cases, and healthcare workers, because we are also seeing that there is a chronic global shortage of personal protective equipment, and that health workers are actually starting to get affected in some countries. There have been reports of health workers who have been exposed because they do not have the adequate protective equipment. So as WHO studies the broad impact of mass use of masks, we do recommend that as much as possible, what is available, that we should prioritize these high-risk groups. And ultimately, our aim is that whoever uses a mask should know that it is not, you should not have a false sense of security that it will prevent you from getting COVID. There has to be a combined approach. You prevent droplets through coughing or sneezing in the right manner, but that you also use hand hygiene, washing your hands frequently with soap and water or an alcohol-based rub, and also cleaning of surfaces, so that you don't think wearing a mask will protect you 100%. It is a combined approach that everyone should bear in mind and be educated about.
Thank you, Fiona Braka, Country Officer for the World Health Organization. Thanks for your time. The Lagos Commissioner for Health, Professor Akin Abayomi, says there is need for a new strategy that will prevent the spread of coronavirus in the state. According to him, there is an increase in the number of cases within local communities from an initial 18% to 45%. What this means is that more people are being infected at community levels, and this calls for caution. But the strategy of government is to continue contact tracing to flattening the curve.
Nothing, we would see a very steep rise with thousands and thousands of cases, if not millions of cases. In the blue line, if we just did isolation, contact tracing and isolation, we would see a significant decline in cases because we're interrupting the transmission between individuals. In the green line would be case definition, isolation, and social distancing. And that's what we're doing right now. The green line there would mean we would see much fewer cases because we're contact tracing, we're identifying, and we're isolating. And right now, Lagos is still utilizing that strategy. Our mission is to case identify every possible COVID-19, to isolate them, and to perform contact tracing.
Well, for more measures in curbing the COVID-19 in the country, joining us in Lagos is Dr. Kerinde Samuel, a public health physician. Thank you for joining us.
Thank you for having me.
Now, in China, it's said on Friday that the number of COVID-19 cases imported into mainland China from overseas surpassed the number of locally transmitted infections there. So also reports of travelers who are coming in hiding their symptoms. And we have the Lagos State Commissioner saying that local transfers have increased from 18% to 45%. Why do you think there appears to be a surge?
Okay, thank you. Since the border has been shut, of course, those that had the COVID-19 positive, of course, they have not come out to declare or probably in the community right now. So that will cause us to have more community transmission. So as a lot of people get exposed to them, like we said, even people who don't show symptoms can still transmit the COVID-19 virus. So I think that's the major issue we're going to be having for now, and the need for the lockdown. And if we do not stick to that, or if we do not follow it through, then we are afraid we may have much more community transmission that we may not be able to handle.
We have China taking more stringent measures like making people criminally liable in terms of if you've come from those high-risk countries or you're taking a drug to decrease COVID-19 being detected. Do you think we should take more stringent measures? We hear a few people have been docked and even sentenced following the breaking of the social distancing rule in Lagos.
We may need to, China, of course, like you rightly said, apart from telling people not to come, they ask them to stay where they are. When you come in, they are going to quarantine you for about at least 2 weeks or 14 days. Before then, at least they expect you to show symptoms. For Nigeria, our situation is peculiar. And so we may not be able to take that stringent action.
What do you mean?
Of course, we talked about religion, ethnicity. We talked about also the economic situation. A lot of people have to eat on feed on a daily basis from what they sell. So I would say that, like the Commissioner of Health was saying, there's a need for us to have what we call community engagement. A lot of people don't even know what COVID-19 is. Once they hear COVID-19, they think it's just for the elitists. So there's a need for us to actively engage them, to inform them, and create awareness on what COVID-19 is.
So in one sentence, will we succeed in flattening the curve?
Yes, we can, if we do what we're expected to do.
I'd like to thank you, public health physician, Dr. Kerinde Samuel. Thank you for your time.
Thank you.
Well, let's checking on Spain. Well, authorities say the daily number of deaths from the coronavirus in the country has fallen for a fourth consecutive day, raising hopes that the country has passed the outbreak's peak. Spain has recorded more than 135,000 confirmed cases across the country, the highest in Europe, but with the number of cases slowing.
An increase in the number of deaths today means that more than 13,000 people have died in total. A total of 6,023 new infections were registered between Saturday and Sunday, fewer than the 7,026 new cases in the previous 24 hours, and 7,472 between Thursday and Friday, bringing the country's total infection cases to 130,759. The rest of the population has been living under severe restrictions for more than 3 weeks now, with lockdown measures now extended towards the end of the month. But there is more good news, as more than 40,000 citizens with the coronavirus were discharged from hospital. 7,000 people have been admitted to intensive care units so far. The Health Ministry, which has been monitoring the data, says the pandemic is falling in nearly all regions. Over in Italy, the police has been enforcing strict lockdown restrictions for the population as it nears the 5th week of quarantine due to the outbreak. The lockdown officially ends on April 13th. UK authorities, on the other hand, are worried that recent spell of warm weather will tempt people to head outdoors in defiance of the country's lockdown rules as it battles the COVID-19 pandemic. Meanwhile, Prime Minister Boris Johnson remains in hospital after being admitted on Sunday evening as his symptoms of COVID-19 persist.
Let's now take you to a live feed of the World Health Organization's website each moment. Regular updates about the spread, the reach of the pandemic across the world. You also have the opportunity to get some of your questions, frequently asked questions, answered there, all concerning the pandemic at your fingertips. The World Health Body is still maintaining risk assessments of the pandemic to a threat level of very, very high. It's a daily update on the COVID-19 pandemic, and we'll be back again at 9 p.m. Join us then. In the meantime, we'd like to hear from you. Send us a picture or short video on social distancing or your staycation this period. Thanks for watching. I'm Minister Antonwaka. Bye for now.